Hello. Today we're going to do a foot exam on Katie. Katie has diabetes. She has been doing her best to take care of it, but we're going to examine her feet today. Katie, can you put your feet in my lap, please,
Sure.
ma'am? Her A1C today was 6.8, so she is doing well. Are you eating right?
I'm trying to.
Good. And you've quit smoking.
Yes.
So we're doing well. She is doing a lot of things to take good care of herself. And how often do you inspect your feet?
I try to do it every day.
Okay. Well, when you inspect your feet, do you see if they're warm?
Sometimes.
Do you wiggle your toes?
No, but I will.
Okay. Well, what I'm going to do is I'm going to see first that she has good circulation, because diabetics have decreased circulation in their feet. And so I'm looking at her feet, and they're nice and they're warm, and I appreciate you washing them before we came in today.
You're welcome.
And she has good peripheral return here. Her toes, when I pinch them, turn pink again. And we'll feel her little pulses here. This one right here is the dorsalis pedis, and it's got like a tube. And back here is her posterior tibial, and she's got really strong circulation in both of her feet, which is good, and I can kind of tell just because they're warm and they're pink. And looking at your nails, I see you've had a pedicure recently.
Yes.
All right, Katie, I'm going to have to break your heart here, darling. We don't want you going to those people anymore because they don't know how to take care of good diabetic feet. You don't have to go to a podiatrist.
Oh, okay.
It's real important that you cut your toenail across straight so that you don't have any little rough edges that can catch on the side. And it's also important that you look at your toes, between the toes, to make sure there's no toe jam, that there's no little flakes of skin, that you don't have a fungus starting something. It's just important not to go have pedicures just because you don't know how clean their instruments are, and if you get an infection, you're really at the freak of the diabetic.
Okay.
So you're going to have to do your nails yourself, okay?
Okay.
All right. Now, I'm looking, and you don't have blisters, you don't have scaly skin, you have a little bit of callousing on the bottoms of your feet, and this is a good thing to have because it's protection. If you don't like the thick skin, you can always put lotion on it at night, but I don't want you using a razor to try and cut it off because that's just asking for more trouble.
Okay.
Okay? So your skin is nice and warm. The next thing that I'm going to do is I'm going to check the sensation, because diabetics also have problems with neuropathy, where they don't have good feeling in their feet because the nerves are not working as well. That was awkward, but I'm sorry. All right, so I have a monofilament, and I'm going to check your feet. Do you see how this is? It doesn't hurt.
Uh-huh.
All right, now I'm going to get you to close your eyes and say yes when you feel this.
Okay. Yes. 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 Yes.
You have excellent feeling. You didn't miss a single one.
Good.
And that's important. I'm going to give you one of these as a souvenir today.
Okay.
And I want you to use it every night when you are inspecting your feet, when you take your shoes off.
Okay.
It's important for you not to go barefoot.
Okay.
I want you to wear shoes. And every night when you take your shoes off, I want you to do a visual inspection of your feet and make sure that you don't have any rough spots or redness or swelling, and that the sensation stays there, because if you begin changing how your sensation is, it's something I need to know about quickly. Okay? Now I'm going to do a vibration test, and this also will help me figure out if your nerves are as they should be. So I'm going to hit this on my hand and put it right here on the hallux of your toe, your right toe, and I want you to tell me that you can feel it, and then when it stops vibrating. And
Okay.
Close your eyes for me.
Okay.
All right, now I'm going to do this one. Can you feel it?
Mm-hmm.
Tell me when it stops.
Now.
Good. All right, now I'm going to see how strong you are. I want you to push your feet up against me, and then pull, then push to the side, and then in. All right. Well, I think we've done a complete foot exam. Do you have any questions?
No.
All right. It's important that we do your feet at least once a year. Now, if you don't come to me, you need to go to a podiatrist every year.
Okay.
Okay? And if you notice any changes, you need to make an appointment to see me so I can see what's going on.
Okay.
All right. Thank you very much.
Thank you.